name is Kaylin Skinner. This is my head-to-toe assessment video for Nursing 7110 at Auburn University's Nurse Practitioner School. Alright, this is Adrienne Martin. She's going to be my test dummy. If you don't mind, we're going to do a head-to-toe assessment. We're going to start with your head and go down. Okay? Alright, first thing I'm going to do is inspect the head, make sure everything is symmetrical, make sure the head is normal cephalic and everything looks good. I'm going to feel the head, make sure there's no lumps. Is there any pain when I touch your head?
No pain.
Anything? Okay. Alright, and the hair is distributed evenly. There's no baldness anywhere. Okay. Alright, next I'm going to go to the face. I'm just going to do some cranial nerves. Alright, so close your eyes. Okay, feel that?
Yes.
Feel that?
Yes.
That?
Yes.
That?
Yes.
Okay. Alright, that cranial nerve is intact. That's cranial nerve 5.
Okay.
And then I'm going to do the pain. Okay. Feel that?
Yes.
Feel that?
Yes.
That?
Yes. Yes.
Okay. Alright, and that's intact. Alright, next I want you to clench your jaw. I'm going to just feel, is there any pain through
No
here?
pain.
Okay. Alright, so all that is intact. Next I'm going to move on to the eyes. Oh, and I also want you to move your jaw back and forth. Okay? Feel anything abnormal there?
No.
I want you to smile. Okay? The TMJ joint is also intact. Okay? I'm going to feel your sinuses. Is there any pain there?
No pain.
Okay, what about there?
No pain.
Okay. Alright. Next I want you to smile for me. Okay, frown. Lift up your eyebrows. Puff out your cheeks. Okay. Alright, very good. All the cranial nerves are intact. Okay, next I want to do the eyes. I'm just going to look at the eyes and inspect them. There is no redness. Everything looks symmetrical and even. The eyebrows are evenly dispersed. We'll look at the conjunctiva. Okay, and it's pink and moist, it's not pale. I'm going to look at the lacrimal duct. There's no redness or blood. Same here. Okay. Next, I'm going to use my ophthalmoscope and look into the eye. Okay. I'm just going to get closer to you. Alright, the red reflex is seen. The optic nerve is yellow and normal. The blood vessels and the arteries are present. Okay. To this side. Okay. The red reflex is present. The optic nerve looks good. Everything looks normal. This side too. Okay, next we're going to do, I want you to cover your right eye, and I'm going to cover my left eye. So, tell me when you see my hand.
See it?
Okay. Alright, opposite. Look forward.
Yes.
Okay. Alright, very good. Alright. Now I'm going to check your pupils. Just look forward. Okay. Again. Alright, I see it in both eyes. Alright, again. Okay, and both eyes are reactive, so the pupils are equal and reactive to light. Next, I want you to look forward and just follow my finger with your eyes. Okay? Okay, very good. Alright, and now I want you to cover one eye. Look forward. Alright, the cover test, negative. Her eyes staying symmetrical. Do the next side. Okay, very good. Alright, next I'm going to do the nose. I'm just going to look at it, inspect it from the outside. Everything looks, it's symmetrical, no redness, there's no lumps or lesions. I'm going to look into the nose. Okay. Alright, the hair is distributed evenly, there's no redness. The septum is midline. There's no redness in the nose on this side. Everything looks good. Okay. Alright. Now I want you to open your mouth. Okay. Say ah. Alright. Now stick out your tongue and wiggle it around. Okay. The mucous membrane is pink and moist. There's no redness in the throat. Everything looks good. The lips are pink and moist. The teeth are white and clean. Okay. Everything in the mouth looks good. Alright. Next, we're going to move on to the ears. The first, inspection first. I'm just going to look at it, make sure everything looks okay. The ears are equal. There's no redness, there's no lesions, everything looks good. So I'm going to look in the ear, the tympanic membrane. There's the ear canal has no redness. The tympanic membrane is intact. It's a pearly white color and a light reflex is seen. Okay. Alright, well this one looks good too. The tympanic membrane is also white. See the light reflex. Everything looks good. Alright, that's good. Okay, one more thing. We need to do the cranial nerve 1. So cover one of your nostrils.
Coffee.
Okay.
Coffee.
Okay. So the smell is intact. Alright, next we're going to move on to the neck. First I'm going to feel the carotid pulse. Okay, and it's 2+ and bounding. I'm also going to inspect the neck, make sure everything's symmetrical. There's no deviation in the trachea, that I can't visually see the thyroid. I can't see anything. I'm going to go from behind. Okay, easy to swallow. Okay, I'm not able to palpate the thyroid. Alright, I want you to swallow one more time. Okay, I can feel the trachea, everything feels normal. And then I want you to do some range of motion with your neck. I want you to go to one side, go to the other. Okay, and I go forward, look up. Okay, and I rotate. Alright, and then I want you to push against my hand with your head. Okay, this side. Okay, now do your shoulders. Okay, very good. Alright, now I want you to lay back for a second. And then I'm going to lean your head to the side. Okay, the external jugular is visible. I can see it. If I put pressure on it, I can also see the internal. The pressure is good, so the jugular venous pressure is good. Alright, you can sit back up. Alright, I need to assess your lymph nodes. So I'm going to go pre-auricular, your post-auricular, your occipital, your submandibular, your submental, your anterior cervical, your posterior cervical, and your subclavicular. Okay? Alright, all of that is good. I can't feel any of her lymph nodes, so that's good. Next, I'm going to go to the carotid. I'm going to listen for the brute. I do need to do that.
It sounds
There's no brute nodes in the carotid. Okay, and next I'm going to move on to the thoracic area. I'm just going to inspect the chest to make sure that the breathing is symmetrical, that there's no abnormalities, that one side's hyperinflating more than the other. I'm going to feel right here. I want you to take a deep breath. Okay, that's good. Alright, and now every time you feel me touch you, I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, alright, very good. Alright, I'm going to do some percussion on the back. Okay, that's good. I'm going to assess for pain in the costovertebral angle. Any pain?
No pain. No pain.
Okay. Alright. Next I'm going to also take the lung sounds.
It is the right choice, sweetie. Too many bad memories in Halifax. Multitasking. Oh, jeez. Oh, I'm so sorry.
It's okay.
I'm sorry.
That's fine.
Lung sounds are clear. There's no abnormal breath sounds. Next I'm going to go around to the front. And the same stuff. Okay. I want you to say 99 when you tell me.
99, 99, 99, 99, 99, 99, 99, 99,
percussion.
Mr. Nugger?
Yeah. Oh, Ryan.
Deputy Salverson again. I just have a few more questions. Is now a good time?
Not really.
Okay.
Sure. Yeah.
Okay.
We'll get to the second.
No dullness.
So listen, going back to the emergency room,
Next, I'm gonna listen to the alarms.
a broken nose, is that it?
I just remembered.
Sir,
You know, I gotta be honest. I'm starting to feel a little a mess here.
now, that's not,
Get on with it. Sir.
I think she means you.
You're asking about a fella that I might have talked to.
Lung sounds are clear on the front also.
Be out there looking
Next I'm going to palpate
With all respect, sir, you're
for the
what's
apical
not the only
impulse.
victim here.
So start from the back and I'm going to go forward.
Plus, you know, Sam Hess.
Okay.
I told you I hadn't seen
Is there any pain?
No pain.
Okay.
Yes,
Okay. Next I'm going to listen to your heart sound. Start at the apex.
The all-new season of Flu. Monday, May 5th on
And to the tricuspid.
Viewer discretion advised.
Pulmonic. And the aortic. Okay. I don't hear any regurg. I hear S1, S2. Everything sounds normal. I'm going to start on the bottom with the bell.
Lester and Hess went to high school together, and Hess used to beat him up.
Every detective might consider that a clue.
That's what I said. But Bill's a big believer in coincidence, apparently.
He lacks the common sense he makes up in self-esteem.
I'm going to feel the pulses and make sure they're all okay.
Oh, yeah.
This one is a
he
2
says
plus.
It was free.
For the radial,
He roofed her for, quote, gamma drifters.
they're also 2 plus.
Like it's 1742. Like,
And so is the brachial. Okay. Alright, next we're going to lay back. We're going to do the abdominal
Thanks, Chief.
assessment.
Says the
I'm going to start by inspection. The stomach looks symmetrical. I don't see any abnormalities, no bulges, no masses. I'm going to auscultate
And the driver has a
the
head injury and maybe went to the
bowel
emergency
sounds.
room where he talked to Lester about Sam Hess. And then within 24 hours, Hess is dead. And then there's the fracas with, Lester's wife and Bird.
Not sure if you remember, but when you were 5, they had to put you under anesthesia to fix your teeth. Gave you that
Bowel
mask.
sounds are active in all 4 quadrants. Now I'm going to listen for a bruit in the right renal artery,
And 31 died.
the aortic,
I know. But it's relative.
the left renal artery,
There's the kind of things that a school teacher gets exposed to.
the right common iliac,
Then there's the stuff the cop sees.
the left common iliac,
Murder, violence, general scofflaw.
the femoral,
Then there's the kind of deal you're looking at now,
Which is?
which is
and no bruise
if I'm
heard.
right,
Alright. Next I'm going to do
sad,
concussion.
pure and simple. Slaughter, hatred, death,
Okay.
dead-eyed, shark
Um,
smiles.
there was dullness heard, so that's normal. Next I'm going to just do some light palpation. Is there any pain?
No
Their
pain.
faces.
Okay. Alright, I'm going to go a little bit deeper. See if I can feel the organs or any pain now.
No pain.
Okay.
How you gonna think?
Alright. I'm not able to palpate any of the organs. I'm going to do some percussion over the liver, see if I can see the size. Okay. Okay. Alright, measures about 6 inches across. Alright, so that is done with the abdomen. You can go ahead and sit back up. Do your arms. I'm going to inspect the arms. The skin color is even. I don't see any lesions. I'm going to feel I'm going to do the capillary refill. Okay, and it is good. Less than 3 seconds. I want you to grip my hands. Okay. All right. I'm going to feel up here for a lymph node. And there's no lymph node present right there. Next, I want you to hold your arm out. We're going to check your reflexes. Okay, let's do the bicep. Okay, tricep. Very good. Tricep. Okay. Tricep. Alright, very good. Alright, now let's do some range of motion with your shoulders. I'm going to just feel your shoulders. Is there any pain there?
No pain.
Okay. I want you to lift your arms up. Okay. And down. Rotate them out behind you. Alright. Now I want you to reach this hand over your chest. Okay. Pull it back out to the side. Very good. Alright. Now let's do some range of motion with your wrist. I want you to lift your wrist up. Put them back down. Okay. I want you to clench your hands together. Let them out. Very good. Alright, now bend your elbow. Let it out. And I want you to put your hands supine. Okay, very good. Okay, I'm going to get you to lay back down so we can do the legs. Alright, so I'm just going to inspect the legs as much as I can see. Looks like the color of the skin is the same as everywhere else. There's no hair present. I am going to check the pulses in the feet. Okay, the costovertebral is good. Okay. 2 plus. Alright, feel the pedal. Also 2 plus. 2 plus. For the femoral. They're all good. Alright. Is there any swelling or pain in your knees?
No pain.
Okay, there's no pain in the ankles. The ankles are not swollen. Okay. Alright, next I want you to do some range of motion for me. We're going to do hip first. So I want you to take your left leg and put it over your right leg. Alright, and I want you to pull it out this way. Okay, very good. Now do the other leg. Cross. Now. Okay. Alright, and then I want you to pull your knee to your chest. Alright, and do the other leg. Okay. Alright, I want you to scoot back just a little bit. 2 feet. Okay, now we're going to do some ankle range of motion. I want you to pull your feet back toward me. Alright, now push them forward. Alright, now rotate them. Okay, very good. Alright, now let's do some knee range of motion. I want you just to lift your knee to chest. There we go. Alright, I'll do the other leg. Bend it and lift it to chest. Okay, very good. Alright, that's good. Alright, now let's go ahead and stand up. We're going to do some, look at your spine. Okay, I want you to bend over a little bit. Alright, the spine is midline. I don't see any bulging disc. Everything looks normal. Is there any pain in your back?
No pain.
Okay. Alright, now we're going to do some range of motion. I want you to bend over. Okay, now I want you to bend all the way back. Alright, and I want you to rotate your hips around. Okay. Alright, that's very good. Now I want to do the Romberg's test. I want you to close your eyes. Alright, and then go heel to toe. Okay. Now I want you to stand still with your eyes closed. Okay, there's no swaying, everything looks good. Alright, next I want you to turn around. I want you to walk on your tiptoes back to me. Okay, very good. Alright. Okay, well that is the end of our head to toe assessment video. Everything was in normal limits. I didn't find any abnormalities. Everything looked good. Thank you, Adrian, for working with me and doing that with me.
You're welcome.
Alright.